All right, welcome. Today we are diving deep into the science of something we all encounter medicine. We're going to decode the fascinating strategy behind why your prescription is a pill, a patch, or an injection. So, have you ever actually stopped to think about that? Why is your painkiller a pill, but maybe your allergy medicine is a nasal spray? Well, it is definitely not random. There's a whole world of strategy behind it. And it all comes down to finding the fastest, most effective path for that drug to get where it needs to go. Okay, so here's our game plan. We're going to start with why the route is so critical in the first place. Then we'll explore the big ones, taking something by mouth, applying it topically, and of course, injections. And we'll wrap it all up by looking at how a doctor puts all these pieces together to pick the right path for you.
First things first, let's tackle the big question. Why does this all matter so much? To really get it, we need to understand the fundamentals of how drugs get delivered.
The official term for this is the route of administration. And really, it's just what it sounds like. It's the journey a drug takes to do its job. And just like any road trip, the path you choose makes all the difference in how quickly you get to your destination and what shape you're in when you arrive. So if you zoom all the way out, you can basically split all these paths into two main highways, systemic and local. As you can see here, systemic drugs are the long-haul truckers. They travel throughout the body. Local drugs, they stay put. Let's break that down a little more. Honestly, it's pretty intuitive when you think about it. If you've got an eye infection, you want the medicine right there on the eye. That's a local effect. But for something like a headache, the problem's inside. You need that painkiller to get into your bloodstream so it can travel all the way up to your brain. That's a systemic effect. And this choice, local versus systemic, is one of the very first decisions that has to be made. Okay, now let's talk about the route we all know best, the oral route. Popping a pill seems so simple, right? But believe me, there's a really complex journey happening inside your body long after you've swallowed it. Yep, swallowing a pill is by far the most common way we take medicine. The drug travels down into your GI tract, your stomach and intestines, and from there it gets absorbed into your bloodstream. But this journey is not without its challenges. And this is where it gets really interesting, because it's all about a trade-off. On the one hand, pills are awesome. They're convenient, they don't hurt, and they're relatively cheap. But on the other hand, they can be slow to act, which is no good in an emergency. Plus, the harsh acid in your stomach can literally destroy some drugs. And then there's this major hurdle called the first pass effect. So, what is that? Well, think of your liver as a security checkpoint or a tax collector. After a drug gets absorbed from your gut, its very first stop is the liver. And the liver's job is to screen and break down foreign stuff. So it metabolizes a chunk of that drug right away, and only a fraction of what you originally swallowed might actually make it into your system to do its job. It's like a drug tax. So how do you get around that liver tax? Well, this is where things get clever. By designing a medicine that dissolves under your tongue or in your cheek, you can use this brilliant workaround. The area is full of blood vessels, so the drug gets absorbed directly into your bloodstream. It's a shortcut that completely bypasses the stomach and, crucially, that first pass tax in the liver. The result? Faster, more potent action. All right, let's switch gears and look at a totally different strategy, putting the medication right where it's needed for super targeted local results. And topical isn't just about skin cream. It's a huge category of treatments. We're talking creams and gels, sure, but also transdermal patches, eye drops, ear drops, even nasal sprays. The huge advantage here is delivering the medicine directly to the problem spot. Transdermal patches are a really cool example of this. Instead of getting one big rush of medicine, these patches provide a slow, steady, controlled dose right through the skin. This means you get a consistent effect over hours or even days, which is a game changer for things like pain management. And listen, here is something super important to remember. Just because it's on your skin doesn't mean it's not powerful. You have to follow the instructions. Using too much, applying it in the wrong spot, it can cause side effects or just make the drug not work as well. Technique really, really matters. Speaking of technique, let's talk about inhalers. They are a perfect example of this. Getting that medicine deep down into your lungs where it can work requires precision. You can see from these steps, you have to shake it, use a spacer, get your timing and your breathing just right. If your technique is off, most of that medicine ends up uselessly on the back of your throat instead of in your airways. Okay, on to our third major pathway, the parenteral route. It sounds fancy, but the name literally means outside the intestine. And yep, we're talking about injections, a way to bypass the digestive system altogether. This diagram gives you a fantastic bird's eye view. See, not all shots are created equal. The depth of that needle, whether it goes just under the skin, into the fat, deep into the muscle, or right into a vein, completely changes how quickly the drug gets absorbed and starts working. And this illustrates that point perfectly. Look at the angle. A 90-degree angle for an intramuscular shot, like a vaccine, gets the drug deep into muscle tissue, which has a great blood supply for quick absorption. But a 45-degree angle for a subcutaneous shot, like insulin, puts it in the fatty layer just under the skin, where absorption is much, much slower. It's all about controlling the speed of delivery. And then, of course, you have the ultimate in speed and control, the intravenous or IV route. By putting the drug directly into a vein, you get 100% of it instantly. There is zero delay, no absorption issues, no first pass effect. This is why it is the absolute gold standard in an emergency, when every single second counts. So we've looked at all the different highways a drug can take to get where it's going. But how on earth do doctors choose the right one? Let's bring it all together and look at the complex calculation behind every single prescription. This table really sums it all up beautifully. A prescriber has to weigh every single one of these factors. How fast does it need to work? Is this a true emergency or a long-term condition? Is the problem on the skin or deep inside the body? Can the patient even swallow a pill? And what about the drug itself? Will stomach acid destroy it? All of these questions funnel down to that one final choice. And this quote just nails it. The choice of route is never random. It is a careful, scientific balancing act between the drug, the patient, and the goal. The mission is always the same: find the safest, most effective path for that medicine to take. And that brings us to the end. But it also opens up a really exciting new question. We are on the cusp of some incredible new technology. Things like painless microneedle patches or smart pills that release drugs at a specific time or place in your body. So what does this mean for the future? How might these new routes completely personalize medicine for each and every one of us? Definitely something to think about. Thanks so much for watching.